Hello guys, welcome back to my channel The Physiosapien, and in this video I am going to guide you through your second year journey, all the subjects included in second year, what all books to refer, how to study each subject, what importance does your second year hold with your third year, and what all topics from your first year are required in your second year. So this will be your guide through your second year. So first of all, congratulations on clearing the first step of becoming a physiotherapist. Now coming on to the second step. Before that, we need to see what all topics from the first year. Why did you study first year in the first place? Okay. So coming on to anatomy. Why was anatomy necessary in your first year? Because for kinesiology, kinesiotherapy and electrotherapy, it gives the basis to them. How? In kinesiology, we talk about all the joint functions, the osteokinematics and the arthrokinematics. For that, to ease in learning of that, we require the knowledge of anatomy. Next is kinesiotherapy. In that, the major use of anatomy is for the muscle function and the various structures which we learn in anatomy. Next is electrotherapy. The nerve cores, the nerve roots and the nerve conduction and the function of various nerves and the nerve supply to various muscles. All these are important for electrotherapy. Next, coming on to physiology. Physiology is important for almost all the subjects in second year. So first coming on to the pathology, microbiology and pharmacology. One thing we have learned in physiology is the normal functioning of various systems in our body, and to know the abnormality caused by various microorganisms and pathogens, we need to learn how it is functioning normally in the first place. So physiology is important for microbiology, pathology and pharmacology for that reason. Next is electrotherapy. In electrotherapy, the most important thing is knowing the physiological effects of various modalities. How an electric current help in relieving the pain, what is the effect of heat and cold on the body. So physiology is important for electrotherapy for that reason. Next is kinesiology and kinesiotherapy. We have learned about various systems like the cardiovascular system, the respiratory system and the muscle contraction. All this help in understanding how we can apply the various maneuvers of kinesiotherapy to treat any disease in any system of our body. Okay. Next is biochemistry. Biochemistry and microbiology go hand in hand. You can say microbiology is the next step, is an upgraded version of biochemistry. So biochemistry forms the basis of microbiology. The last is the first year internal subjects, that are the fundamentals of electrotherapy and the fundamentals of kinesiotherapy and kinesiology. Both of these subjects forms the basis of the second year internal subjects, which are the kinesiology, kinesiotherapy and the electrotherapy. So both of these internal subjects in first year are very important for you to have clear concept for your second year exams. So now talking about the second year subjects. These include internal subjects and the external subjects. Okay, in external subjects we have our pathology and microbiology. Okay, next we have pharmacology, and the third one is psychiatry, including psychology. Okay, and the internal subjects are your electrotherapy, your kinesiotherapy and your kinesiology. So basically all these subjects are included in your second year according to MUHS. Now we will be discussing each one of the subjects individually, and I will tell you which book to refer, how to read, how much importance to give, and how is it connected with your third year subjects. So starting with the external papers first, the first paper comes is pathology and microbiology, which is a 80-mark paper. Okay, we have only theory for that, there is no practical, and the 80-mark paper is divided into two sections, which is 50 marks for pathology and 30 marks for microbiology. Okay, And the 50-mark pathology is divided into two parts. That is, you have to attempt 5 out of 6 questions, which are 7 markers, and 1 out of 2 question, which is a 15 marker. And in microbiology, we have 3 out of 4 questions for 5 markers and 1 out of 2 question for 15 markers. So this is the division of the paper of pathology and microbiology. And now coming on to the books to be referred for pathology, the most important, the most basic book, okay, and the most important, which is Hirschman for physiotherapist. You can also refer to the bigger version of Hirschman, which is usually used by the MBBS and the BDS people, but everything you need for physiotherapy is included in Hirschman for physiotherapist. And how to learn pathology. The most important thing in pathology is the diagrams and the flowcharts. The more flowcharts you make, the easier pathology becomes. Okay. And why is pathology important? It is important for the clinics, okay, to so that we should know how the disease is going to progress and how should we plan the treatment of the disease. It is important for that, and it is related to the third year subjects of surgery and medicine, as it forms the basis to both of these subjects. Okay, the next is microbiology. For microbiology, you can refer to CP Baweja or Anantha Narayan as per your choice, but I personally refer to CP Baweja because it was enough for me and the concepts were very up to the mark. I didn't opt for Anantha Narayan, obviously. And in microbiology, you should understand the various organisms which cause the disease and the diagnostic measures which we take to identify the various microorganisms causing the disease. Okay, and it is important for your clinics and theory exams in the third year, which are of pediatrics and medicine. So the next external subject is your pharmacology. Pharmacology is a 40-mark theory paper which is divided into 5 out of 6 questions of 3 marks and 5 out of 6 questions of 5 markers. And the books to be referred for pharmacology are KDT, which is a standard book. It is a very detailed and an amazing book. But you can also refer to Schanbach, which is quite a concise book. And if you are starting late with pharmacology and want to cover all of it, you can prefer Schanbach. And one important tip for pharmacology is read it daily. You can't miss a day without reading pharmacology, or else you won't be done with pharmacology. Okay, so read it daily, revise it by writing the classification and not just mugging it up. And yeah, the most important thing, remember the adverse effect. Not all diseases have the adverse effects of nausea and vomiting, especially the antiemetics. Okay, so make sure you learn about all the adverse effects so that you know which therapy to give in if a patient is under some drugs, which therapy to avoid and which therapy to give him. Okay, so you need to learn all of this properly, and pharmacology is very, very important for us. Okay. Now, third external subject is psychiatry and psychology. It is a combined paper of 40 marks, which is divided into 25 marks for psychiatry and 15 marks for psychology. So in psychiatry, we have 5 out of 6 questions for 5 markers, and in psychology, we have 5 out of 6 questions for 3 marks. Okay, and the most standard book for psychiatry is Neeraj Ahuja, and for psychology, it is C.T. Morgan. Okay, and psychiatry and psychology both are very easy to understand and learn subjects. Okay, you can complete this both of these subjects in a span of like 2 weeks. Okay, so one question which will definitely come to your mind is, we are physiotherapists. Why do we need to learn about psychiatry and psychology? So the thing is, a person suffering from a physical pain or physical disability or any disease which affects his day-to-day functioning, that also affects his mental state. It affects how he is thinking about himself. And by studying psychiatry and psychology, we can learn about the mental state of the patient and how we can motivate the patient, and we get to connect with the patient more. So therefore, psychology and psychiatry is very important for you as a physiotherapist. So in case this question comes to your mind again, do remember this. Here we are done with our external subjects and now starting with the internal subjects. So internal subjects follow a same paper pattern. Each paper is of 80 marks and is divided into 3 sections. The first is 5 out of 6 marks for 3 markers, and next is 5 out of 6 for 7 markers, and then 2 sets of 1 out of 2 for 15 marks. So all the 3 papers, that is kinesiology, kinesiotherapy and electrotherapy, follow this same paper pattern. Okay, now starting with our kinesiology. For kinesiology, the GOAT book, the greatest of all time, that is Cynthia Norkins. It has everything that you need in your second year kinesiology. Okay, so with what headlines should you study all the joints of kinesiology? So these are, first is the introduction of the joint, next is articulating surface, the proximal and the distal surfaces, next is angulations, various angles like Q angle, angle of inclination, all of these angulations, then attachments which include the ligaments, capsule, menisci, labrum, everything. Next is kinematics, which is then divided into osteokinematics and arthrokinematics. Next is kinetics, which is the muscle work. So the last is the additional features like the scapulohumeral rhythm, in the glenohumeral joint, the arches of foot. All of this form your answer for the 15 marker of any joint, and this can be asked individually in 3 and 7 markers also. So this is how you study kinesiology. And now, why is kinesiology important? Kinesiology talks about the biomechanics of the body. That means how a body should function and how various activities should be carried out, and what all muscles work there, what all joints move in that movement. All of these are included in biomechanics. So for a patient with an impaired shoulder, okay, he can't do your flexion, extension or whatever. So whatever structure is affected and what all strength and mobility do you need to attain to reach that level to achieve your day-to-day activity or the sport activity. To know all of this, biomechanics is very, very important. Therefore, you need to learn kinesiology. So the second internal subject is kinesiotherapy. For that, you need a wide variety of book. Okay, the first one is Kistner, second is Cash for chest physiotherapy, next is Dina Gardiner, next is Kendall, and the last one is Norkins. Okay, in Kistner you can learn the strengthening and stretching of various muscles and joints. Joints को strengthen कैसे करते हैं? हम muscle strengthen किए तो joints भी हो गया. Okay. From Cash for chest PT, you will learn the postural drainage, breathing exercises, and nebulization. From Dina Gardiner, you will learn the joint mobility, Frankel's exercise, and walking aids. From Kendall, you will learn MMT and posture, and from Norkins, you will learn about the gait. So all these books are necessary, and for different topics, you need to refer different books, and there are more books available. But the content in all these books will be enough for your second year. And if you want to gain more information, you can surely refer other books from your seniors. Okay. And the most important part about kinesiotherapy is your practical knowledge is far more important than your theory knowledge. Okay. You are going to be hands-on with the patient. You need to know how to practically do a stretching, or how to practically plan a strengthening program, how to practically do postural drainage, how to teach a breathing exercise, how to check an MMT in the position which the patient is available. You can't turn the patient from supine to prone. How will you check the MMT in supine? For example, how will you check the MMT of gluteus maximus in supine position? You need to learn the practical aspect for kinesiotherapy. So kinesiotherapy, all these books, and there is no limit to kinesiotherapy. You can go for various other books too. So coming on to the last subject, that is electrotherapy. The paper pattern for electrotherapy is same as kinesiology and kinesiotherapy, which is an 80 marks theory paper and an 80 marks practical paper as well. Okay, for electrotherapy, the books to be referred are Clayton, Simplified Electrotherapy, Jagmohan, Starkey, and Low and Reid. Again, electrotherapy is a vast subject and there are many books, and for each topic you can refer to different books in whichever you find there is enough content for your answers. You can read that book for that specific topic. And if you wish to know which book did I refer for a specific topic, you can DM me on Instagram at the Physiosapien, and I will let you know. Now coming on to the practical aspect of electrotherapy. In electrotherapy, you should remember the physiological effects, the therapeutical uses. Yes, both of them are two different things. Okay, and you need to remember the indications and contraindications. In which condition, which modality you will give. You need to know that. How to give the modality. What are the exact motor points and how an SGC curve looks like for innervated, denervated and partially innervated nerve. All these things are important for you to learn electrotherapy properly. And the practical paper is also for 80 marks divided into 2 short cases and 1 long case. So that is electrotherapy, and we are done with all the subjects for second year. And if you have any doubt regarding that, do let me know in the comment section. So the last topic of today's video is about my notes. So I have made first and second year notes, and the first year notes were circulated throughout Mumbai, and around 25 to 30 students have bought it with a positive response apart from my college. And the few peculiarities about my notes are that this is highly precise and detailed notes, unlike the other notes which are just superficial and are helpful for revision purpose, and you need to keep a book side by side so that you can read it in detail. So you can completely rely on these notes, and I have included all the PYQs, the last 5-year PYQs in these notes. I haven't mentioned them separately, but if you cross check, you will find all the answers to your PYQs in these notes. And the next thing is you will get lifetime access to these notes with all the updates I will make in the future. Yes, these notes are not free. These come up with a minimal charge, and to know more details and get a sample about the notes, you can DM me on my Instagram at the Physiosapien. So this was all about today's video. In this video, we have talked about how first year is important for second year and how second year forms the basis for your third year. And in second year, we have discussed all the subjects, their paper pattern, which books to refer, what importance does each subject hold in your clinics, and how to study each subject. That's all for today's video. I hope I have cleared all your doubts regarding how to prepare for your second year. And if you have any more doubts, do let me know in the comment section. Like this video, subscribe to this channel and share it with all your physiotherapy friends, because learning together is growing together. This is Ronak Chandak signing off.